fighting opioid abuse, Paint by Nature, and workforce grants. This and more up next on this week's edition of Lexington Now. I'm Neil Noah, and welcome to Lexington Now for the week of October 1st, 2018. Lexington has been given a major weapon in the war against opioid abuse in the form of a sizable federal grant. Here's more.
Today, I'm pleased to announce that Lexington has received a $2 million grant that will provide funds for additional weapons we can use in the war on opioid abuse. As we all know, too many citizens throughout Lexington have been impacted. This grant, which stretches over 4 years, will largely be used for naloxone kits to be distributed through the health department and to supply deputies at the sheriff's office with a life-saving medication designed to rapidly reverse opioid overdoses. This grant will also allow us to hire an overdose prevention coordinator, someone to help get people who are overdosed into treatment. And something else. The grant will fund outreach efforts to help people understand the state's Good Samaritan law. That law provides legal protections for individuals who call for emergency assistance in the event of a drug overdose. We all know that opioid abuse has become a public health emergency, and we've worked hard to put programs in place that our citizens need, such as the needle exchange program at the health department, intervention and treatment programs at the detention center, workshops at area churches, equipping police and fire with naloxone, and joining a class action lawsuit to hold pharmaceutical companies accountable. This grant will help us build on these programs. We want to thank Senator Mitch McConnell's office and Congressman Andy Barr's office for their support of the city's grant application.
Our Department of Social Services is fortunate to play a small role in the city's strategies to confront and combat substance abuse. I wish to thank Mayor Gray, our administration, and the Urban County Council for its support of our substance abuse intervention program since its establishment in the summer of 2015. I also want to acknowledge our program coordinator, Amy Baker, who led the development of our grant proposal, and our team in the Division of Grants and Special Programs for standing with us as we pursued these much-needed resources. I also want to thank our public safety leadership team here at City Hall. Commissioner Armstrong, Chief Weathers, Chief Chilton, Director Haney, all have been very engaged in this work. We all know it's our first responders who are on the front lines of this community battle with opioids and substance abuse each and every day, and we hope this grant will help their work. Just a few key facts about the grant. In 2017, there were 187 fatal overdoses in Fayette County. This grant is funded by the U.S. Department of Health and Human Services through its Substance Abuse and Mental Health Services Administration. The title of this initiative is the First Responders and Community Partners Overdose Prevention. Its goal is to strengthen Lexington's overdose prevention networks by expanding infrastructure and availability of resources, of which the mayor mentioned earlier. Work is already underway this fall to activate these initiatives. We'll be working closely with the mayor's office, the administration, and again the council to move forward as quickly as possible. We will continually to seek ways to efficiently administer these grant funds and to leverage with additional resources when available. In addition, the UK Center for Drug and Alcohol Research will assist in grant evaluation during the next 4 years.
Thanks, Mayor Gray, and thank you, Commissioner Ford. We're very pleased to be partnering with Urban County government on this particular project. When Amy Baker and Commissioner Ford's team called us up and asked us to partner, we said certainly we'd be glad to do that. As you've heard, overdoses in this city continue to be a serious public health problem. Overdoses in Lexington residents doubled between 2013 and 2017 in the city. We at the health department continue to work to train about naloxone and distribute naloxone to the public as part of the needle exchange program, but also in a wider sense as well. As you all probably know, naloxone is a reversal agent for opioid overdoses, so it reverses the serious effects of an overdose and it therefore can save lives and give people another chance, a chance at recovery.
When this grant was first applied for and the city did not receive it, we wondered how we were going to help those who were overdosing in front of our courthouses, and it does happen weekly. And so now today we have to wonder no more. So thank you, Mayor Gray, for that commitment to helping us help our citizens save lives and to help our citizens keep their most cherished possession, their family members, their sons, their daughters, mothers, fathers, brothers, and sisters. Together, this will be a great tool in our war in fighting this horrific epidemic. And so I also just genuinely want to thank the U.S. Department of Health and Services for making this decision and for seeing the need here in Lexington, Fayette County. Thank you.
The Pam Miller Downtown Arts Center is hosting an art exhibit celebrating Lexington's waterways. The exhibit is entitled Paint by Nature.
This is the Paint by Nature Streamside exhibit, currently on display at the Pam Miller Downtown Arts Center through October 21st. It is a partnership between Environmental Services and Art Connects, and it's a way to highlight different green spaces and streamside restoration projects in Lexington. This project was actually the brainchild of Dawn Schroyer. She was a member of the inaugural class of the Citizens Environmental Academy. And while the project didn't fit within the scope that we had for the Environmental Academy projects, we loved it and worked with Dawn to have it become reality. On the walls around me, you'll see 72 different pieces of art by 60 artists, highlighting 13 greenways in Lexington.
In Kentucky, we're very blessed that we have so much running water. We have more miles of running water than anywhere else other than Alaska. And so the colors that we get of green are amazing. Walking down to Veterans Park, I'd been there many times and never knew that the creek ran through it. And so my husband and I walked down there to photograph, and it was just beautiful, the lines and the reflection of the lines in the trees, in the water, and the late evening sun where the sun filtered through the leaves and created this yellow glow, and it was just amazing. When I painted it, I laid in my dark lines of the trees and the lines in the reflection in the water. And then I went back with 7 layers of perspective from farthest away to closest in layers of painting. And that's what we've got.
My decision to paint by nature, I love the outdoors first of all, and I had a friend tell me about Paint by Nature, and I thought it was a great idea so that we could showcase parts of Lexington that don't often get seen, especially streams and little lakes. We don't have that many in Lexington, so I thought it would be a great opportunity to kind of feature some parts of Lexington that don't often get seen. I had visited it before, driven by it many times and walked through it a few times. We actually brought my dog and my daughter out there while I painted. I painted for about a half an hour live, plein air, and then I took my reference photos back to the studio and painted because it was a really, really warm day. But it has good visibility from Cross Keys, and so I thought, oh, that'd be a great spot to kind of feature and highlight.
Paint by Nature is a complimentary program to our Plant by Numbers, which was just launched this summer. It is a template for folks who may not be very confident or familiar with gardening to actually choose which plants. We have these available at several local nurseries and garden shops, so they can take it around with them and choose plants. Here in the exhibit, we have an interactive game, so looking at a picture sometimes doesn't give you a very accurate idea. You can map it out and see what it might actually look like in your yard. Throughout the remainder of the Paint by Nature exhibit, we have a few special events happening. This exhibit is at the Pam Miller Downtown Arts Center It will be on display through October 21st, and there is more information available at lexingtonky.gov/paintbynature.
The exhibit is open until October 21st. When we come back, we'll have more from our continuing series on the city's Workforce Grants program.
Come join us for Little Goblins Galore on Saturday, October the 13th at McConnell Springs from 1 to 5 p.m. We will have a petting zoo, a friendly haunted house, lots of performances, and a really great character trail. Admission is $6 per child, and there'll be lots of other fun surprises for you. My friends and I hope to see you there.
I'm Sergeant Randall Combs with the Lexington Police Traffic Unit. Accessible parking is a valuable and necessary resource for people with disabilities, and that includes the striped area next to accessible parking spots. These are access aisles, and it is illegal to park here, even if you have an accessible parking permit.
Access aisles are necessary for me to get into my vehicle. They are there because many of us need that space to use our ramps or to transfer into a wheelchair. It's frustrating when a car is parked in the access aisle because I don't have room to get into my van.
Police and Lex Park are writing tickets when they see vehicles parked in an access aisle, and the fine is $250. Know where and where not to park. Keep the access aisles clear. Thank you and drive safe.
Welcome back to Lexington Now. Over the past few weeks, we've been highlighting several of the people who've been helped by the city's Workforce Grants program in a series produced by our own Brett Smith. Here are a couple more of those success stories.
I had no job, no money, 4 kids. It was pretty stressful. My mother had heard from her minister about Jubilee Jobs, and he had suggested that for me. So they just told me to show up on Monday, and I did.
We have a 2-week jobs program, and it's open to anybody looking for work, whether they're out of work completely or maybe working part-time or some kind of a limited basis. They're welcome to come. We have an orientation program that we do every Monday morning starting at 9 o'clock, and everyone is welcome.
There was a week of hands-on classes. We did mock interviews, they helped with the resumes, kind of gave you some tips and tricks on how to make yourself look better to an employer, things like that. After that, you know, I went out there with my new resume and put in for jobs. It wasn't very long after that I had received a call back from Amazon, and here I am. I would like to say thank you to the staff at Jubilee Jobs for caring so much and taking the time to really make me feel confident that I can do it on my own, and it's been great. She attended an orientation program just like everyone else, but I noticed something different about Walani. One of the things that we require of our clients is that they stay engaged with our program, and Walani did a super job with doing that. I could tell she was really interested in getting employed and moving along, and that's a great quality. Employment does so much for your self-worth and confidence. It really does, and they definitely help bring that back to me.
I work 12-hour shifts at the hospital, and I basically bring in patients, do their assessments when they come in, take their blood pressures, their temperature, check their blood sugars, help them with any assistance they may need, basic day-to-day assistance, and just trying to help them get back better and healthy so that they can go home.
She got into the last class for the night class. So she was here for 5 weeks, 5P to 9P, Monday, Tuesday, Wednesday. She had clinicals on the 4th weekend, 7 to 3 in the nursing home. Did a fabulous job, made great grades with her tests and all, and now here she is. She started at a factory job, went into another position at a nursing home, and here she is going into the Veterans Center to help with them.
We see people in their teens, in their 20s, and just, it's very mind-changing, helping you be grateful for that you're healthy and able to do things, and just being one-on-one and hearing people's stories. It helps you realize a lot of things in life. The benefits are way better, the pay's better. I want to apply to nursing school, whether it be BCTC or Midway, and get my ADN, which is an associate's degree in nursing, and then go back and get my BSN, which is the 4 years in nursing.
September was National Preparedness Month, but it is by no means the only time to focus on being ready for disasters. John Bobel of Emergency Management reminds us of this year's theme and how to be ready when disaster strikes.
This year, what we're encouraging people to do is to remember that the first 72 is on you. During a community emergency, it's likely that first responders, the fire department, police department, other first responders won't be able to get into your neighborhood unless it's an absolute life-threatening emergency. So we want people to make sure that they've got 72 hours or 3 days worth of water, drinking water, stored away, that they have 72 hours worth of food that's easily prepared. One of the things that's become very popular over the past couple of years is meat that's prepared in foil packets. You can get tuna fish, you can get chicken, along with non-salted crackers. Dried fruit is a good idea. Make sure you get food that you like, because no one wants to eat survival food when you're already stressed during an emergency. Make sure that you have a good first aid kit, stocked properly. If you take medicine for some sort of chronic or ongoing condition, rotate 3 to 5 days worth of medicine in and out of your emergency kit. You don't want to have to look up and find out you're out of insulin if you're a diabetic, or high blood pressure medicine if you have that condition. Certainly other things we want people to do is know how to be aware. Even during a power outage, it's important that you have a battery-operated radio, that you have means to charge your mobile devices, your cell phones. The best way to communicate is through text message. Don't try and make phone calls. It's likely the phone systems as well as the cell phone systems will be overloaded. A text message will go through when a voice message will not. Text messages don't get busy signals. They may be delayed a little bit, but generally speaking, text messages will go through when regular voice messages don't. We want people to get involved with their community, check on their neighbors. That's a very important part of Lexington. You know, as we've seen many times when Lexington has been faced with adverse conditions such as the ice storms and blizzards and other situations, people are very willing to help each other out. But you have to know your neighbor to check on your neighbor. As soon as you check on yourself and you know that you and your family are okay, we want to make sure that you check on your neighbors, make sure that they have what they need, and if you can help them, please do. The best thing you can do is to make sure you have a current CPR certificate. Those CPR classes don't take very long, and CPR can save a life, save many lives in fact. Take a first aid course that's offered by the Red Cross. There's also a class called Stop the Bleed. Should there be some sort of event where there is an injury that results in bleeding, when you take the Stop the Bleed course, you know how you can pack that wound or apply a tourniquet, stop the bleeding, and save that life. Here at Lexington Emergency Management, we have our Community Emergency Response Team classes, CERT for short. You can find out more about them on our BeReadyLexington.com website. Also, the Citizens Police Academy, the Citizens Fire Academy, those are all good ways to help the community too. The Lexington Blood Center always needs people who can donate blood. So once a month, once every couple of months, stop by the blood center, give a pint, save a life. That's all part of September being Emergency Preparedness Month in Lexington. And as always, you can find out how to be better prepared at BeReadyLexington.com. And if there is an emergency, that's where you'll get the best information as well.
You can always find more information on preparedness at BeReadyLexington.com. That's all for this week. Keep up with us on social media and check out the latest traffic updates on Twitter at LexRex, or catch our live traffic cams on LexingtonKY.gov. For the staff and producers at Lex TV, I'm Neil Noah, and that's it for now.